Hi everyone. In this video, I want to discuss a group of points known as 33.08 and 33.09, which are located just above the halfway point on your forearm and a little towards the ulna. So these points are very beneficial for shoulder, neck, and upper back pain because they're located on that superficial back arm line. I like these points because you can get a great response with them just by using pressure alone. So anatomically, the way we find these points is we come up halfway up the forearm between the ulna, which is the bone that runs here, and the radius here. So you come up halfway and then come up about another half inch and then a half inch towards the ulna, okay? So that's the first point. Now, the second point is about 1.5 inches or 1.5 sun just above that. Now, as we explore this area, you'll find that there's variation from person to person or even variation within yourself from day to day about where those most tender points are located, okay? So this is an interesting area as well, and it's easy to find the trigger points here. It's easy to get a good response. And because there's these three muscles here, we've got the extensor digitorum that runs down the middle, and then the extensor ulnaris, which is towards the ulna, and then we've got that third muscle, the extensor radialis, running here. Now, these points, 33.08 and 33.09, they're going to be located between the extensor digitorum and the extensor ulnaris. Now, you may find that the more sensitive points are either in that middle muscle, extensor digitorum, or that they're in that muscle that's closer to the ulna, the extensor ulnaris. So begin by just exploring through that area. And we want to do the cross fiber stimulation here. So as I press into those muscles, you can also feel that there's a space between the ulnaris and the extensor digitorum. So find that space between those two, and then you can start to explore either muscle as well. So the muscle is going to have a little mound, and then there's a depression between the muscles, and then there's another depression when you reach the other muscle, okay? So start to explore in there until you find the most tender points. And then we can also apply the neck movements with these, okay? So right in there, continue to explore. And you should really be exploring from about the halfway point up to just below the elbow, because some of you may get sensitive points right in here. Now, there's another acupuncture and acupressure point that we can get a good response with. It's known as LI10, and it's located very near these points, about in this region here. This is located about 2 sun or 2 inches below elbow crease, okay? So these points are just a little lower, but some of you will find more sensitivity through there. And since all of these points are on that superficial back arm line, they're going to have a similar action, okay? So for now though, let's keep our attention on these points 33.08 and 33.09. And I like to rest my hand if I'm doing this on myself, and this is the way I like to teach people, is bend your elbow and then find the space between the extensor digitorum and the extensor ulnaris. Find the most sensitive spots. And then when you do, you can do the cross fiber stimulation, and at the same time, you can do your neck movements. So I'll demonstrate. Those are my neck extensions and flexions, and then I can do rotations as well. As you do these, you should notice a release like that I just felt literally by pressing those 2 points in that moment. I felt my whole body relax. I felt tension release from my back and from my low back and in various other places as well. So that just shows how powerful these points can be for releasing tension from your whole body. And if you do massage or some sort of manual therapy, you know how powerful touch can be for releasing physical tension as well as emotional tension. So let me demonstrate again and explain a few other things. So as you do this, you should notice that your shoulders start to relax. When I just had that release, I felt the tension through the top of my shoulder blades release, and then my shoulder blades dropped, and I felt that even lower into my spine. So as you do this, allow your shoulder to relax. That's going to cause a release of contraction within the trapezius, and that's what we want. That's how these points work, is they can release those chronic contractions and alleviate the pain where there's chronic tension. And so as I do those rotations, then that's going to assist in the actions and the functions of these points. And this is why it's so important to combine these two. To finish this demonstration, I'm going to add my neck tilts to it. So when I do the tilts though, I'm just going to apply pressure to the most sensitive area. Now you can continue with that cross fiber stimulation if you like that method, and tilt your head from side to side like this. However, I find that with the neck tilt that it's often just best to hold that point. So I'm alternating my techniques between doing a cross fiber stimulation and massaging across the belly of those muscles. But at times I do want to do a static hold. So I like to do the static hold as I apply pressure. Bring your attention to your breath as you practice this and into your body. And you should notice various levels of release occurring through your neck, shoulders, or upper back. Hold it for about 30 seconds on each side, and then go to the other side. These points are also good for the low back and the hips, so I do like to use them for that. And even for some of the most chronic and stubborn cases of low back pain and hip pain, I can see great results with these points. I often like to use these points after some of the other point groups, but there are times when I do use them right away because they do work so powerfully. So use those for neck, upper back, and shoulder tension. If you don't get a response with those, then you can look to using some of the other point groups.